We are joined from Austin, Texas. Dr. Chad Denman joins us, a graduate of Florida State University, also Marquette University in Milwaukee, and the International Academy of Sleep. He is very active within the sleep apnea and sleep medicine community. He's on the American Academy of Sleep Medicine, a member, and sat on their board. Doctor, good to have you along with us. Thank you very much.
Hey, thank you so much. I really do enjoy listening to SiriusXM every day, so it's always an honor to be on.
Tell us about this oral laser that you and others, a couple, have been working on to work on the issue of snoring and sleep apnea. What exactly is this?
Yeah, so there's two different fields of thought here. One is a fractional laser that targets the collagen in the soft palate, which is the roof of your mouth, and that hanging bag in the back of your throat called the uvula. And by different wavelengths, they can tighten up that tissue over, thus making you have more vertical space in your airway. The radio frequency device works similarly, but has to physically touch that tissue. When we were done with both of those FDA trials, it really did benefit some people, but for the most part, it wasn't a proven line of treatment. But just like with any science, as you progress, there's ones that are very beneficial to the masses and some that just weren't. So this was one that can definitely help with the snoring part, but really didn't benefit the sleep apnea very much.
What's the difference between snoring and sleep apnea?
Yes, great question. So snoring is actually when structures get too close together and vibrate. So let's use that into perspective when you're a mouth breather at night. Your tongue and your soft palate get too close together and they vibrate together. That's what snoring is. But you can also have that same sort of response if inside your nose you have a deviated septum where the area between your nose and your nasal septum and your turbinates are too close together, and those can cause more of a high-pitched snoring, or some people describe it as like a whistling. But yeah, so that snoring is where the structures are too close together. Sleep apnea is where there's no air getting in and no carbon dioxide getting out. It's where you have a complete cessation of breathing for at least 10 seconds at a time.
I got to tell you, doctor, not breathing for 10 seconds at a time, that sounds potentially life-threatening.
It is. It's the whole reason why I'm here is to create and spread awareness and education around it. Most people think that snoring is cute and, it's something that impacts everyone on this planet. And I'm here to tell you that snoring is your warning sign, and no one's listening to that. And that's where the structures are too close together, so you're still getting limited oxygen levels even when you're snoring. And then it's the stopping snoring that I'm most concerned about, because that is when no air's getting in, and that takes a toll on the body's systems. So, for all of your listeners out there, it's interesting to really consider that we get diagnosed with high blood pressure or high cholesterol or diabetes, and we might get a prescription for a pill that you remember to take every day. Well, sleep apnea affects every body system. So on the ranking of how we should be concerned about it, a little bit of cancer needs to be treated, just like a little bit of sleep apnea needs to be treated.
If you start snoring, or your partner says, you're snoring, does that necessarily mean that you're going to be coming down with sleep apnea and getting sleep apnea?
Not in all cases. But it is that body's warning sign. So we actually use a screening tool called the Stop Bang. It's 8 questions, and it's over 90% accurate, identifying who has sleep apnea and who doesn't. It's on our website, free of charge, which I'm sure you'll share, Dan, with the rest of the group. But it's also Googleable if you want to type in Stop Bang, B-A-N-G. You can take that. The very first question is, do you snore, or have you been told that you snore? If you answer yes to that, I recommend a sleep study that can be done in the privacy of your own home. The at-home sleep studies are very accurate now, and a lot of board-certified sleep physicians are now saying that testing if you don't have narcolepsy or restless leg syndrome or one of the other reasons to take an in-lab study, that because it's done in your bed with your pillow and your environment, that it's actually a lot more of an accurate night than spending the night in a sleep lab hooked up to 22 wires and you can only sleep on your back.
Speak just briefly about narcolepsy, and I bring this up because I knew someone back in the day who had narcolepsy and would, I always thought it was sort of a daytime version of sleep apnea, but I guess I was much younger. I didn't really understand what it was. What exactly is narcolepsy?
Yes. So without getting into too much detail, we have different body systems that operate in the parasympathetic or the sympathetic nervous system. And it is believed that narcolepsy is the changeover of those two systems, causing you to pass out. And if it's not just a total shutdown and it's you're actually falling asleep, that needs to be diagnosed in a lab, which actually makes this a very difficult diagnosis to have, because you have to be at the lab at the time that it's happening. It has to be videotaped. Now, a lot of times because they're hooking you up to brain waves during the course of that, they can also check on you and see what time of day does this typically happen. Narcolepsy, it can happen on occasion. It can happen, just at sporting events with bright lights. There can be a trigger, or it actually can happen around the same time of day. So that's where, you'll schedule that time in a sleep lab to actually get that diagnosis done.
The amazing thing was, and not to spend too much time about this, doctor, is that this individual was a prominent member in government in Wisconsin, served in the state legislature, and was in the governor's cabinet. And the way he combated narcolepsy was that he was always chewing ice. Some people have a cup of coffee next to them all the time. This guy would always have a cup of small ice cubes with him and was constantly chewing on ice at times when the narcolepsy would start to flare.
Yes, and that's little things that you can do, whether it's a rubber band on your wrist where you snap it, chewing on ice, anything that kind of keeps you out of that parasympathetic symptom and pass through. Anything you can do to upset that.
It was always something to watch, and he made light of it. He was kind of self-deprecating about it as well, but would make self-deprecating jokes about it. I'm going to go take a nap or something, and it was an interesting guy to be around. Dr. Chad Denman joins us. He is in Austin, Texas. He is an expert final segment with Dr. Chad Denman. He joins us from Austin, Texas. He is an expert on sleep. Dr. Denman, are a lot of drivers, because of their concerns about being diagnosed with sleep apnea and maybe having their CDL put at risk, are they reluctant to go to a clinic to get any sort of a sleep study done? Tell us about that.
Yes, I would say, even within the last 10 years, that has all changed. All these commercial insurance companies now require, if you screen positive, that means your neck is larger than 16 and a half inches, that you put on there that you are in the obese category, which, is your BMI, your height over your weight. And if you're on any medication that's high cholesterol, high blood pressure, any of those would, as a combination, would predispose you to needing a sleep study. So oftentimes they'll send you to an office much like mine. Now, you can have an in-lab study, or you can do a take-home one. Sometimes insurance can get in the way, especially, I'll say this, a lot of the truck drivers that I meet, they typically don't want to lose their license, and usually we only have 1 week turnaround. They're busy, they're constantly driving, and so kind of out of sight, out of mind, it becomes due. and then they'll call our office kind of frantically, and we'll send them home with an at-home sleep study. It may come back, mild, moderate, or severe. All three do require treatment. And then this is where it gets a little complicated with some of the drivers that are out there. I realize that sometimes power can be an issue, so a CPAP might not be your first choice. Oral devices work well in the mild or moderate category. That repositions your jaw and keeps open your airway at night. There are things that if you have a deviated septum or enlarged turbinates inside your nose, we now can regrow your nasal floor through epigenetics. We talked a little bit on laser therapy and radiofrequency earlier on this call. And weight loss is really big. And so, as a truck driver, people are sitting a lot during the day. So GLP-1s can help with that, or being on a very specific diet that helps you, not gain weight and lose weight over time.
I was going to talk about the GLP-1 issue, doctor, because it seems as though we are on the cusp of something medically with GLP-1s that's pretty revolutionary in terms of a drug that was originally forecast for diabetes. And 4 or 5 years ago, they discovered that it did a great job in terms of weight loss.
Yes. So GLP-1s, and they come in many different forms. Some are one specific, we'll use the whole GLP-1 as a type of polypeptide, which means your body makes it. It makes it up to the point, let's say teenagers, 20s. And the reason why as we age that we end up gaining weight is your body becomes less efficient. One with losing weight and tackling all of those calories. But two, a lot of the hunger cessations that you had when you were younger have been depleted. And so incorporating a GLP-1 that just basically covers up that voice in your head that says, hey, I'm hungry all the time, or I'm thirsty all the time. It's pretty much the same center. And it's used to help with sleep apnea. If you're in the severe category and you lose 50, 60 pounds, that'll take you down to the moderate category. If you're in the moderate and you have that to lose, it'll take you down to the mild. And what we're doing is, mostly in those categories, is providing options to patients. Let's at least get started with something. Let's help you get healthier. Let's lose some weight. And then any treatment modality, if we get you out of the more severe category, can definitely work. And so providing those options to patients, if we only have a week to work you in and to be able to treat you, sometimes that's a big carry. But other than that, as soon as you are identified, I would recommend coming into an office and starting off with the sleep study. And then, moving on. You should, if you're only being presented with a CPAP, find an office that will go over all of your options with you.
Doctor, is tobacco use, smoking a factor in sleep apnea?
So tobacco, the smoke does go down inside your lungs. So we'll call those lung cells or lung spaces alveoli. And those alveoli will pick up that tar from you smoking. And so your ability to be able to pull in oxygen and be able to give off carbon dioxide, if you are a heavy smoker, can actually make this disease process worse. So picture a full lung, being able to breathe nice and deep, and then that over time, you smoking, it gets less and less lung volume. So that means your high oxygen content of like 100% saturation in your blood goes down, 97, 96. So it doesn't take much then to get a diagnosis with sleep apnea if you're a continuous heavy smoker.
Dr. Chad Denman joins us on the line. He's in Austin, Texas. Doctor, before we say our goodbyes before the afternoon, take a moment, please, and tell us where they can find out more about the work that you and your team are doing. And if they are interested in being a patient, please tell us how they can do that if they happen to be in Central Texas, in the Hill Country.
Sure, absolutely. And please don't let our location stop you guys. We do ship our sleep studies out. They're disposable nationwide. But our website is www.sleepcyclecenters.com. So it's plural, sleepcyclecenters.com. And you can start off with our free screener on there, meet with one of our board certified sleep physicians, set up a meeting with them. And then if you need a sleep study, we can ship it out to you. Typically, we can get you seen and treated in under a month.
And so if you've got a DOT physical coming up or you've got some sort of a DOT renewal coming up, back time it, figure out how far out you need to do it, and get in touch with you.
Absolutely.
Doctor, are we finding that the number of people who are becoming concerned about this is actually increasing? Because we have a lot of guests on who talk about this particular topic. It seems as though this at least is something that, like mental health, like taking care of oneself, it's becoming more of a topic of acceptance. Hey, I got to get this taken care of.
Yes, and we're starting to scratch the surface on this. So let me just quickly talk. In America, roughly 85 million people have this disease. We're identifying 6% of that 85 million. And out of that 6% that have had a sleep study done, 1% get treated. Now, what we know about treatment is about 50% of the people that get a CPAP stop wearing it within the first year due to a plethora of reasons. We don't have a lot of time to get into all that. But what we now know is it's a broken system. We also know from most cardiologists that are speaking today to their colleagues and other doctors that about 90% of the people that are diagnosed with heart arrhythmias in America also have sleep apnea. So usually by the time you have the heart arrhythmia happen and you get sent in for the sleep study, you've had this disease for 10, 15, 20 years. And so we would like to identify it early on before it has a permanent effect on your heart. And heart arrhythmia is the only way to treat that, or either do an ablation surgery where they burn part of your heart internally, or to wear a pacemaker in your chest. The other thing we see is people in memory care. About 90% of the people in memory care also have sleep apnea due to amino acids that build up on the brain called plaque that cause the dementia and the Alzheimer's.
Dr. Chad Denman joins us from Austin, Texas. He's an expert on sleep. Sleep Cycle Centers is the website. That wraps up the Monday edition of On the Move. This is Dan Ronan. Glad to have you along with us. We thank Dr. Denman and all of our great guests. We'll see you back here tomorrow afternoon, 3 o'clock Eastern Time, 12 on the West Coast.